Monday morning, 7:30 a.m., in the emergency room at the St. Francis Referral Hospital in Ifakara, Tanzania. One of the few moments during the day when it's quiet here. The night shift has just handed over to the day shift. The cots and work areas are freshly cleaned, the cabinets restocked with medication and consumable supplies. The emergency room is ready for the next patients who are going to be treated by the team soon afterward.
Also die Leute kommen von weit her, bis 150 Kilometer. Sie sind meistens sehr krank. Das häufigste sind Infektionskrankheiten, aber auch Herzkrankheiten und gynäkologische Krankheiten und vor allem Trauma. 10% der Patienten kommen wegen einem Unfall.
Set up in May 2016, the emergency room is the centerpiece of the project to establish and organize the emergency department in Ifakara. Dr. Martin Rohacek, a Swiss internist and specialist in emergency medical care from the Swiss Tropical and Public Health Institute, has been implementing the project since September 2015, in close cooperation with the St. Francis Referral Hospital and other local partners. Around 36,000 patients come to the emergency department each year. Key elements of the project are that the emergency room is staffed around the clock in 3-shift operation and a triage system has been introduced.
Die meisten schwerkranken Menschen brauchen rasch Hilfe. Je länger man mit der Diagnose und mit der dementsprechenden Therapie wartet, desto schlechter ist das Outcome des Patienten, also der Patient stirbt dann einfach.
Patients are rapidly screened in the waiting area within the triage system. Trained staff measure blood pressure, pulse and temperature, assess injuries and assign patients to categories. The seriously ill are immediately brought to the shock room. The less ill wait to be treated by a doctor on duty in one of the examining rooms. People used to die while waiting or because they were placed in a ward without emergency care. These days, the team has an eye on everyone and the system ensures that patients feel calm and have faith. 2 days ago, Semen Joseph brought her grandson to the emergency station. The 2-year-old had a fever and abdominal pain, yellow phlegm and blood in his urine. The diagnosis, malaria, a frequent illness in the region. The emergency care physician administered the necessary medication right away. The costs for malaria remedies are borne by the government. Semen is forced to rely on help. Her daughter left the boy with her when he was just 6 months old. The child's father vanished too.
Naweza kuelezea lazima. Maisha yangu ya pale nyumbani kwa kweli ni ya shida. Mimi mwenyewe ni mkulima, yani kuishi kwangu mpaka nishinde juani ndipo nipate chakula.
Ifakara is a small city in the Kilombero River Valley, around 400 kilometers southwest of Dar es Salaam. Including the suburbs, roughly 80,000 people live here, most of them under very humble conditions. The region is called the rice basket of Tanzania. After the harvest, trucks transport countless sacks to other parts of the country, but most of the natives are subsistence farmers, producing just enough for their own family. Others get by on a meager income from a market stand or as a tailor. About 1 million people live in the catchment area in and around St. Francis. The patients come on foot, via tuk-tuk or the railroad. A train arrives 4 times a week, always carrying a big batch of new patients. With its 360 beds, St. Francis serves 3 district hospitals and several healthcare outposts as referral center. Martin Rohacek has introduced 2 key diagnostic methods in the course of the project. Echocardiography is able to provide clarity regarding cardiac problems, and life-threatening conditions such as inner bleeding can be quickly identified and treated with the help of ultrasound imaging. The staff handles the equipment confidently, a result of the intensive training, which is another core element of the project. Courses are given regularly, but more important is teaching and learning in everyday work, at the patient's bed and when handing over the shift in the morning. Last night, a 28-year-old was admitted who had driven his cattle onto the local farmer's pasture. The dispute ended with 2 spears being rammed into his chest. Both lobes of the lung have collapsed. Drainage tubes have to be placed to save his life. Martin Rohacek performs the surgery on the first side and explains what he does and why. For the other side, he hands the work over to a young colleague and instructs him. This kind of training is extremely important, explains Dr. Faraja Kitila, the local project manager.
So the target for Dr. Matt to supervise me is just to know how to say, so this is correct, and at the end of the procedure to say, yes, you did good, better, so now you can proceed. If you can get another patient with this working diagnosis, you can do just the same as we do. Yes.
Martin Rohacek brings along roughly 20 years of clinical experience and has already worked in remote regions under difficult conditions. If an emergency is brought in, the 49-year-old is right at home. In Ifakara, he functions above all as trainer and advisor. As the consulting physician, he is always reachable via cell phone, so that support can be called when cases are tricky or situations aren't clear. Ramatambala comes regularly for an echocardiogram due to a heart ailment. Several months ago, the 49-year-old stopped taking the prescribed medication for financial reasons. Rama grows rice and maize, works as fisherman and sometimes as boatman for visiting guests, but he only earns just enough to feed his family of 13. Today's testing has shown that he urgently has to take medication if he wants to stay alive.
Mimi nalizika kutokana na yeye anapima na majibu yanatoka pale kwenye chombo yanaonyesha kwa shida pana alama 1, 2. Kwa hiyo nalizika kwa sababu dawa anazoandika nikienda kuchukua mimi napata kupata pumzi vizuri na kupata wepesi kufanya kazi nyingine ikiwa nzito.
Around 100,000 patients have benefited from the project since the emergency department was established. 10 clinicians and 13 healthcare professionals at the St. Francis Hospital have received training in emergency medicine, ultrasound or echocardiography. 40 young physicians were able to acquire several months of experience at the emergency department after concluding their studies.
Sisi kitu baada ya hii project kuanzishwa, kitu ambacho tumepata faida tuliyopata kubwa, tumejifunza vitu vingi ambavyo tulikuwa hatujui, namna gani tufanye haya mambo ya cardiopulmonary resuscitation na kujifunza kuoperate hizi mashine. Kwa kwetu sisi ndio faida ambayo tumeona tumepata.
As of yet, very few clinics in southern Africa run a comparable emergency department. Meanwhile, Ifakara has a role model character. The Tanzanian Ministry of Health is planning a nationwide expansion in alignment with this standard. And the team gives lectures at other clinics on how good emergency medical care doesn't have to be expensive.
Und eigentlich braucht man nicht viel, man braucht einen Monitor, eben vielleicht ein Ultraschallgerät und einige wenige andere Geräte wie EKG und so weiter. Aber das ist nicht das Wesentliche, sondern die Organisation und das Training ist das Wesentliche.
The team wants to use the prize money to buy another ultrasound unit and various spare parts, but above all, to set forth and intensify the training. The goal? To train the medical staff in Ifakara on a long-term basis, as well as to train more local instructors in emergency medical care and ultrasound technology. That's how the people in charge want to establish a long-lasting structure, create a stable environment for patients, and continue to save lives.